Who knows what prescription drugs are? Over the counter? Not exactly. From a doctor, right, exactly. What were you going to say?
They're consulted by a doctor.
Exactly. On to the next slide. So they're medications that are prescribed by doctors. And usually they're intended to treat a specific symptom when they're taken properly. So for example, over here we have HIV treatment. HIV medications that are used to treat the symptoms associated with HIV. But keep in mind, it works at its best, and it's usually what we would like to consider to be as safe as possible when they're used properly. However, a lot of the times people don't use drugs properly. They'll end up crushing pills, trying to snort them, or injecting them in different ways that wasn't prescribed the way they should have been. And also it's important to keep in mind that even if you take certain drugs just as the doctor prescribed, it could still lead to various side effects and also addiction. So there's this myth that prescription drugs, since they're legal, they are often safer than non-legal drugs. What do you think about that? Are they safer just because they're prescribed by a doctor?
No.
No, great. So the reality is, just because it's legal doesn't always mean that it's safe. So there are a lot of risks to prescription drugs, just like any other drugs you could use. One of them being side effects. So we have headache, nausea, drowsiness. I'm sure if any of you have taken any sort of prescription drugs to overcome a flu or any other disease like that, you've probably experienced some of these side effects yourself. Aside from that, there's overdose. If you take too much of a prescription drug, it could often lead to different organ failures, and that could lead you to go to the hospital due to an overdose. And finally, addiction. So addiction is a major thing that we're going to be talking about today, and prescription drugs are no exception to the fact that most drugs can lead to addiction.
So there are a lot of different types of prescription drugs that can become abused and become abusive, and today I'm going to talk about, can become abused and become addictive, and today I'm going to talk about one class of drugs called prescription opioids. And I'm going to talk about Vicodin and Oxycontin as specific examples. But first of all, has anybody seen the show House? Yeah, a few of you. But this is a really popular show back when I was in middle school and high school. So this man, Dr. House, he's on the show he's depicted as a very brilliant doctor, but he's also a Vicodin addict. However, he on the show he's depicted as being very functional and intelligent and can do all these medical procedures. But in reality, Vicodin and Oxycontin addicts are not very functional at all. They often feel that the drugs they're taking and their addiction are overtaking their lives, which goes to show that Hollywood is often not the best place to look for information about drugs, and that his addiction is very much glorified. So today, I hope that I can tell you some facts about Vicodin and Oxycontin. So first of all, Vicodin is a drug that's prescribed by your doctor, typically used for pain and used for medium to severe pains after surgeries. And it's actually a mixture of two different drugs. The first is called hydrocodone, and this is an opioid painkiller, which we'll talk more about later. And the second drug in the mixture is just Tylenol. Oxycontin is a brand name for oxycodone, and what this means is that some company decides to make oxycodone, and they advertise it and name it Oxycontin. And oxycodone, like hydrocodone, is also an opioid painkiller, and this is prescribed by your doctor whenever he or she thinks that you need it, and it's typically used for pain due to cancer, heart attacks, severe burns, or bone pain. I've mentioned the word opioid several times now, so what they are is that, like we have mentioned before, the brain uses these chemicals called neurotransmitters to communicate, and opioids is one of these chemicals. These can actually either be taken as a drug and come from outside your body, or they can actually be released from inside your neurons. So opioids, they bind to these receptors called opioid receptors, which are found in your brain, your gut, and your spinal cord. And whenever there are enough opioids to bind to these receptors, you get a feeling of reduced pain, or you can also get induced feelings of euphoria, and euphoria is just extreme happiness. And however, this also causes many side effects, which can sometimes be very undesirable or even very dangerous. Some examples of opioids include hydrocodone and oxycodone, like I've mentioned before, but also morphine and codeine, which is found in cough syrup. And these first four examples can be found in prescription drugs given by your doctor whenever your doctor thinks that you need this. However, heroin also belongs in the same class of drugs, but this is illegal, and you cannot get this from a doctor, and it's illegal to use this for any reason in the United States. Like I mentioned before, our bodies actually naturally produce opioids, and one of these is called endorphins. if you have seen the movie Legally Blonde, here is Elle Woods, and she explains these pretty well. She says that exercise gives you endorphins. Endorphins make you happy. Happy people don't shoot their husbands. They just don't, which just kind of shows you that, when you think of the high they get after your exercise, it's like these drugs kind of work similarly. So what is considered prescription opioid abuse? There are actually two ways that you can abuse these drugs. The first is if you took somebody else's prescription that's not yours. And first of all, you can use this to feel extremely happy or relaxed, because like I said, one of the primary effects of opioids is to induce a feeling of euphoria or extreme happiness. And the second, like somebody has mentioned before, you may go about your day having having an existing condition that causes you a lot of pain. So these people might take somebody else's prescriptions to relieve the pain they already have without a doctor's recommendation prescription. And secondly, even if you take your own prescriptions, even if you get your own bottle of Vicodin or Oxycontin from the doctor, but you don't use this according to your doctor's orders or recommendations, this is also a type of abuse. And this can happen, for example, if you decide to crush the pills like this and snorted it or injected it, or if you decide to chew them without your doctor saying it's okay, or for example, if you use any of these drugs more often than your doctor said that you should, this is also a type of abuse. And just going back to taking somebody else's prescriptions, if you sell your prescription opioids like Oxycontin and Vicodin to your friend, this is actually a federal crime, and you may go to prison for it. So aside from feeling reduced feelings of pain, like extreme happiness, there are some undesirable side effects of Vicodin and Oxycontin abuse. For example, you can get nausea and vomiting, severe mood swings, headaches, constipation, and most dangerous of all, you can get slow breathing and heartbeat, and which can lead to death, because eventually your breathing and your heartbeat becomes so slow, you just kind of stop breathing, your heart stops beating altogether, and you can definitely die from that. And if you decide to snort these drugs, this can be especially dangerous because it'll lead to an increased risk of addiction and overdose, as well as any of these side effects. And secondly, if you decide to combine these drugs with something like other drugs like alcohol, this is also very dangerous because alcohol is another type of drug that can slow your breathing and heartbeat. So when you combine two drugs that can slow breathing and heartbeat, what would you get? Like even slower breathing and heartbeat, right? So this will lead to even higher risks of death. Both Oxycontin and Vicodin and lots of other forms of prescription opioids are extremely addictive. And like we mentioned before, even if you adhere to the doctor's orders 100%, there's still a chance that you might become addicted to these drugs. However, the risks for that are pretty low. But the risks of addiction does increase with increased use and abuse of prescription opioids. And after you use these drugs for a very long time, when you suddenly stop using them, you get something that's called symptoms of withdrawal. And symptoms of withdrawal are often the opposite of what we experience when you're on the drugs. For example, when you're on prescription opioids, you get pain relief, but when you come off and get withdrawal symptoms, you get like muscle aches and pains and cramps. Instead of constipation, you would often get diarrhea, but you would also have agitation, and you would also get nausea and vomiting during withdrawal. And that's all about prescription opioids, and Amir will talk about another class of prescription drugs.
Alright, so for prescription opioids, we've got constipation, vomiting, nausea, diarrhea. Doesn't sound too good, right? So I'm going to be talking about Xanax today. It's a little bit different in the way that it works, but as you can see, it also has a lot of similar effects as well. So Xanax is a part of a drug class known as benzodiazepines. Can everyone repeat that for me? Benzodiazepines. Right, it's like a really long, weird word, right? And actually the word is so long and it causes you to talk and say it so slowly, and that's actually what the effects of benzodiazepines are. So it's used to treat panic disorder and serious anxiety, and what it does is it just slows down your brain and enhances the slowing functions of your brain to just calm you down during these events of panic disorder or anxiety. So what it does is it acts as a central nervous system depressant. So as you can see here, you've got your brain working as a little tortoise, so it's going super slow compared to how it usually is. And it makes use of the GABA neurotransmitter. So we talked about dopamine and serotonin being involved in the reward pathway and all this like excitatory work, making sure the connections go together. What GABA does is it actually just slows down the connections between your brain, okay? Ultimately producing this drowsy and calming effect. So we have this first, the synapse over here, just without any benzodiazepine binding to the receptor. And as you can see, not too much happening, but once the benzodiazepine does bind, you have this release of the neurotransmitter, and it actually enhances the effects of the GABA neurotransmitter once it's inside of that synapse. Okay? So as you can see, a lot of side effects when it comes to benzodiazepines like Xanax. Just like opioids, ton of side effects, but we're just going to focus on a few. So you have a loss of interest or pleasure. Like we said, once you start taking drugs like this, you get a different sense of what's pleasurable. You start off, the drug is pleasurable, and you end off, nothing's pleasurable unless I'm on that drug. You also get unsteadiness, trembling, weird motor coordination, as well as a decreased breathing rate, which we said was also very important when it came to opioid abuse. And mixing Xanax with other depressants like alcohol can actually be deadly. If we go on to the next slide, you can see Heath Ledger, who's very famous for playing Joker in the Batman, Whitney Houston, who's a famous singer, and Anna Nicole Smith. Have you heard of any of these celebrities before?
Yeah.
Yeah, so they all have one thing in common, and that's that they mix Xanax or other benzodiazepines with alcohol or other just central nervous system depressants like opioids. And one big thing about withdrawal when it comes to benzodiazepines like Xanax is that stopping immediately could actually lead to seizures. Because like we said, when you're on the drug, you have those effects of being super slowed down and calm. But once you stop, you have the exact opposite effect. So everything is firing very, very quickly. And with all these increased firings, you could get seizures, and that could actually lead to death. So when it comes to stopping benzodiazepines like Xanax, you really want to do it slowly in order to prevent getting these seizures and make sure that you're doing it as healthy as possible. Finally, for treatment, there are rehab facilities that you could go to that could help you overcome any kind of prescription drug abuse, as well as drug abuse counselors that could help you. Just having someone to talk to is probably one of the best ways of going about dealing with addiction. You know, and it doesn't necessarily have to be a drug abuse counselor. It could be your friend, a counselor here at school. Anywhere that you feel comfortable is the best place to go and find someone to actually speak with and just see what treatment options are available. And just knowing that you have someone there who's always willing to listen to you. And I mean, we have a few places on our campus that we're going to pass out at the end that have examples of places that you could go to. Just knowing that you have somewhere to go and a safe place to be is probably the best way to take that initial step and get the treatment that you need. Okay. Does anyone have any questions? Did anyone learn anything today? Raise your hand if you want to. All right. Does anyone want to share one thing that they learned? Yes.
And when you mix Xanax and alcohol, you die.
Awesome. That's a great thing to know. You get a nice little drink for that, right? There you go. We got brains. Did anyone else learn anything now that they know that we have brains?
We learned about opioids and how about like there's a lot of types of drugs that you can like use and mix with that could cause death and like side effects and stuff.
Right, a lot of side effects of drugs. Great. Oh, now everyone wants a brain.
So we have a natural opium and it's called endorphins, right?
Endorphins, yeah, great,
yeah.
great. Okay, we'll make that the last one. We have one more presentation, but we're going to pass out more brains right after, okay? And we're going to have more times to answer questions during the breakout sessions.